and we've got a very good number of people on the phone call now. Now, I've got with me Peter Collignon, who is a specialist in infectious diseases and a physician and microbiologist at Canberra Hospital. He is currently Executive Director of ACT Pathology, Professor at ANU Medical School, where in fact you taught my husband briefly, who said you were absolutely fantastic, so thank you for that. Heavily involved in public health advocacy, including sitting on World Health Organization committees and the Australian Quality and Safety Commission. And I believe you have an AM for services to medicine infectious diseases. So we really couldn't have someone who was more qualified at the moment to talk about what is happening across Australia. Thank you, Peter, so much for joining us. Peter, I might just start by asking you to explain how serious is what's happening. People are seeing numbers. They don't seem particularly high at the moment, but obviously there is an underlying level of concern there, and we're watching what's happening overseas. Can you explain how serious the current situation in Australia is?
Well, the situation globally is obviously very serious. A lot of people are dying from this infection. In Australia, we're still fortunate in that we appear to have minimal transmission in the community. In other words, all the cases we're seeing are related to people who have acquired it predominantly overseas, most recently in the US, but before that, China, Iran, etc., with some transmission to their contacts, people at home and contacts, but not much transmission from person to person in Australia, which is good news. Now that may be because it's still warm here and we're not in winter, but other countries have also achieved control of this. For instance, South Korea does, Japan, Hong Kong, etc. So it's not out of the question that we may achieve that. But what is obvious is that the people who are most at risk are those over the age of 70. Even in Italy, I'm not sure, there's very few people, who've died under the age of 50, and almost nobody under the age of 30. And that's China and lots of places. So this is a risk for people over the age of 70 predominantly. Although over 60 it's a risk and over 50 it's a risk, but less than even in those bigger age groups. So my view is what we need to do mostly is protect those over 70, because that's where most of the deaths and suffering and hospitalizations will occur, and maybe drop that to 60 or 50 depending on how much spread there is in Australia, and currently there's not a lot. But we need everybody to do the social distancing and not mix, because while people in their 70s and 80s are the people who mostly come to serious grief with this, people at least in their 20s and 30s on the available data in Australia are the ones who have the most infections. So we need to stop them getting infections as well, so that they don't transmit it to others that might transmit it to people who are older.
Yep, fantastic. And what accounts for the fact that you suddenly in some countries see an explosion in numbers occurring? What's going on there?
Well, I think some of the explosion.
Yeah, you suddenly.
I think some of the explosions that are occurring in other countries is because it's actually been circulating there for quite a while and wasn't recognised, because so many people had mild disease. And it's only when they start seeing more deaths and finally do some testing. And I must say the test has only been available for 4 or 5, probably 6 weeks even in Australia, and we had to develop it ourselves. But people who are over the age of 70 and 80 die of influenza every winter, and it's winter there. So, it took a while for people to realise. And to some degree, I think people are a bit too complacent. They thought, oh, this is a problem in China, it won't affect us. But obviously it did. I think in the US, for instance, it's probably been circulating in the community there for at least 6 or 8 weeks already. Because we've got so many people coming back from the US who've got this infection. A small percentage of all the people come back, but that's our biggest source. It must be widespread in the community there relatively. And now that people come back to Australia, the reason we're seeing an explosion in cases is because everybody's returning to Australia. They're being followed up. We're doing a lot of testing. And again, in New South Wales, nearly all the cases are either people who have travelled themselves or family or contacts of those travellers. Very few are not related that way. Now, that's still good news for Australia, because it means if we do what we should do, protect, people over the age of 70, social distancing much more. In fact, don't use public transport would be my advice. Get people to do the shopping for you, limit the number of people that visit you at home, keep the distance at home, don't let anybody sick come and visit you at home. That may well protect those people, but also if we do all this social distancing, including, I think quite appropriately, closing, bars and clubs, etc., because a lot of people are older goes to those as well, that will decrease the amount of contacts people will have each other. Now, there's something called R0, which sounds, confusing, but what it means is if one person gives it to more than one other person, then we have a problem. It's hard dividing people. So I'll give the example. If 10 people give it to 12 people who give it to 15 people, we have an ever rising epidemic. But if 10 people only give it to 5 people who only give it to 2 people, then the epidemic disappears. Now, that's not very good if you're one of those 5 or 2 people, but it means from a population point of view, we can get the numbers down. And I think that's still possible for us to achieve over the next few weeks. We will see more and more cases over the next few weeks because so many hundreds of thousands of people have come back to Australia from areas where it is circulating, Europe, Italy, but particularly the US. And a number of those travellers, hopefully only a small percentage, but it'll be large numbers of people because so many travel, will become sick. But if they have quarantined properly at home, have limited their contact to their household, limit what contact they have with their household contacts, then hopefully, while we'll see an increasing number for a few weeks, then we'll see the numbers going down.
Yeah. As the numbers come down, is that the time for complacency, or do we still need to be vigilant?
No, we need to be vigilant because I think our biggest risk is winter. I don't think we can be moderately complacent, is the wrong term, but relax some of the things we do until probably October. Because, winter is when people are closer together. They don't go outside as much. Ultraviolet light from sunshine is probably a sterilising agent. So I think winter is going to be where we have to be very concerned that we'll see, even if we get this one down, that there'll be a resurgence. Now, hopefully there won't be, but I think we have to plan as if it would because, it is here and we know that these things spread further in winter. And the reality is the outbreaks in the Northern Hemisphere, be it Italy, Europe, China, even South Korea, where they had outbreaks that got under control, they were all in their winters. Singapore is probably the only place that's, hasn't been really hot, or hasn't been very cold, where they've had an outbreak that got under control. So we'll just have to wait and see. But, I don't think we should give up hope that we may not be able to contain this and control it. But it's hard to imagine that all the virus is going to disappear. And inevitably, are we going to restrict all international travel till next October? I don't know. We've still got people who are going to come in with, freight, etc. So there's always a chance that it could get reintroduced, even if we think it's all gone.
Mm-hmm. And in terms of our health system, how equipped is it to be able to deal with this sort of pandemic?
Well, I think we're in a much better position than a lot of other countries around the world. For instance, we're better in Australia because we've got a much better public health system, public hospital system. However, if you get large numbers of cases, this is difficult to cope with because, you have so many people that need to be admitted to hospital. I think around Australia, more and more elective surgery will be cancelled or is cancelled. That'll free up quite a number of beds. But we'll have to wait and see. That's why it's so important to contain this in all age groups, not just those over the age of 70, because the more we can contain this, the less infections we have, the better we'll be able to decrease the numbers of people getting very sick and dying, and that will mean our health system can cope better.
Fantastic, great. And just on that, what sort of things would you advise people of? A lot of people have organisations with staff. What sort of practical policies should they look at putting in place in terms of their staff?
Well, I think as much as possible to use social distancing, and that means if you can keep 2 metres apart, do so. If you can do some work from home, do so. Wash your hands. We believe, we touch surfaces, we touch our nose or our eyes or our face, and that self-inoculates us from where maybe somebody's coughed. So all those things we need to do. If anybody's sick, do not go to work. No matter what you've got, we won't know very easily. So do not go to work, do not use public transport because that runs the risk of infection. Stay at home, keep away from your own family as much as you can too. If you can have a separate bedroom and bathroom, do that. and try and keep 2 metres away from everyone else, and be a bit more scrupulous at home, or if we're cleaning surfaces, etc. With, just soap and detergent, or detergent should kill the virus to some degree because it's got what we call a lipid envelope. But diluted methylated spirits, for instance, half diluted will also kill the virus on surfaces. So there's lots we can do to actually decrease the amount of virus we come in contact with, and also surfaces we might contaminate. But washing hands is very much a key.
Fantastic. And in terms of caseworkers who might have to provide ongoing support still to some vulnerable clients, now some of that can be moved into support via a version of sort of tele-casework, but some of it still might have to remain face-to-face. What sort of precautions should they take?
Well, I think as much as we can do by, for instance, like this, by Skype or Zoom, etc., we should do. But for people who have to make personal visits, again, as much as possible, try and keep your distance. I mean, I presume there isn't a need for a hands-on approach for the caseworkers. They could do it. So I would think, sit at a long table, it may be a bit difficult if somebody's deaf or something, I guess, but for most people, you should be able to keep about 2 metres apart. And we believe if you could do that, and again, take some alcoholic hand wash with you yourself, because you're better off, controlling your own environment. Keep distance, wash hands, and in that practice, in that situation, because you're visiting somewhere else, use, I would think, if you can, your own, try and have alcohol hand rub that you use on your hands, so that if you do touch any surface that may be contaminated, you can decontaminate it. Equally, we still believe people who don't have symptoms, relatively, we can't say they're not infectious at all, but they must not contribute much to other people getting it, because we don't believe you get this just by breathing air, because otherwise we'd see a much bigger explosion of cases. You get it because people cough and splutter, or maybe they touch their nose when they're infective and touch a bench, and then we touch the bench. So that again is why hands, we believe, are a big way of preventing this. And having your own little bottle of alcohol hand rub when you go and visit, or is probably the best you can do, plus keep distance.
Yeah, fantastic. And what about masks? How effective are masks?
Well, masks, I think, do have some benefit. The problem is, because of bushfires and everything else that are in short supply, I don't actually think the more expensive N95 for preventing this are any better than the surgical masks. And in Hong Kong and places, they've shown they've decreased respiratory tract infections. It may be because it stops us touching our own mouth and nose because it's got a mask on it. So it may be that as much as breathing it in. Our eyes are a real issue. You need not to touch your eyes, because, and I'm trying my best not to touch it, but pointing, you'll be pleased to know, because that is where you might get the virus. So we need to do all those things to stop ourselves from doing it. And I might say it's very difficult not to touch your face and things, but, sit on your hands if you have to. But I don't see any disadvantage in wearing masks, other than you need to realise your mask won't protect you if you do it alone, because if you've got a mask on, it gets contaminated. You then take off with your hands and don't decontaminate your hands and then touch yourself. You may actually get it from your mask, perversely. So yes, if people want to wear a mask, I'm not adverse to that, but the essential things are still your hands and the social distancing, 2 metres. Particularly from areas where you don't know what the circumstances are in that household, etc.
Yeah, fantastic. One of the things my husband talks about, which I'll get you to explain a bit, is comorbidities. So things that people, so we've talked about people who might be elderly, but what other sorts of things might people have that make them more susceptible to this?
By comorbidities, we mean people who have some problem with either their heart, their lungs, etc. It means something else is going on. You're on drugs often for some reason, because you need those for some condition. And interestingly, good news or bad news, but in Italy, where they've reviewed a lot of their cases, I think 20% of deaths, and they've had a lot of deaths, 99% of people who've died have had medical comorbidities, even the people over the age of 70. Now, One of the comorbidities that's a bit surprising to me is just having high blood pressure. But I guess that increases your risk for having heart disease and other issues, maybe an association rather than a cause. And diabetes is a comorbidity, for instance. So a lot of people have these comorbidities. I don't know the actual percentage in Australia, but I would think probably at least 20%, 10 to 20% of the population would have something like that. So there is a lot of people who have those, and particularly if you're over the age of 70, that increases dramatically how many people have that.
And how far away do you think we are from a vaccine? Is that likely to appear in the next couple of months, or are we longer away than that?
Sorry, I missed that. Do you mean a vaccine?
Yes.
Yeah. Well, I think a vaccine realistically is going to be at least a year away, and may even be 2 years away, because this is a completely new virus. It's not like influenza, where at least we've got vaccines similar. This is completely new, and it needs to be adequately checked that, first of all, it's safe. So there's a whole lot of safety studies that will have to be done in reasonable numbers of people who volunteer for it. Then you've got to check it works. And that means rolling it out in a country where there's a lot of transmission, because, to see that it works, there'll probably invariably have to be animal and other experiments first. And then if you're going to roll out the vaccine, if we want to protect the world's population, we're talking about billions and billions of doses that have to be produced. So that's all going to take quite a while. I can't see that happening within a year. Realistically, might be more 18 months, and it might be even as long as 2 years. And we've got to actually, first of all, make sure it's safe and it works before you can even get into the production issue. And that actually means for quite a while, we're going to have to look out, social distance, protect people who are older, and particularly take care with our hands and how crowded we go, what crowded venues we go to.
There's been a lot of discussion about testing as well, and whether or not we're testing people to a sufficient level. I understand in the ACT will have its own rules about testing, and each of the states have their own rules. Are we adequately testing the number of people in the community, and why would that be important?
Well, I think we probably are. I mean, we could do more. I think it'd be nice if we had more tests and more ability, because if nothing more than reassurance, and for us, better knowing what's actually happening with this virus. But I think all the evidence is still that there's not much transmission. And in Australia, we've done probably close to 100,000 tests, and there's less than 1% that are positive. Now, Korea has done more tests than anybody else. I think they've done 360,000 or 380,000. And you say, well, we're nowhere near that. But we've also got half the population they do. So proportionately, we have not done too badly. If you look at England and the United States, which I think have lagged behind us, even though they've had the infection for longer, they have a much higher positivity rate, which means there's a lot more transmission up there that they're not finding. So I do think in Australia, we're in a better position than those countries, and that's evidenced by our lower positivity rate, even though we're trying to pick the highest risk people, travellers, those in contact with known positives, etc., etc. So I think that's all indicative at the moment in Australia. We don't have a lot of transmission, and more that we may have the ability to really get on top of this and make the cases down now that we've stopped international travel, stopped new travellers really coming in, or if they do, they're in quarantine. And as time goes on, there'll be less and less travellers arriving back because there's not the planes bringing them, and we'll have more stringent and, I think, adherence to the quarantine rules.
Fantastic. And in terms of a lot of the settlement agencies that are tuned into this webinar at the moment work with different pockets of ethnic communities across Australia. Some of those don't necessarily have members that don't necessarily have English language capacity. What are some of the key messages that they should be giving out?
Well, I think the key message is that the people most at risk are those over the age of 70. And those people themselves and those who are in contact with them need to be even more diligent about minimising contact physically, keeping our distance, and for those people to spend, unfortunately, more time at home, but not to become absolutely socially isolated, because you need your neighbours to help you, you need your family. But that doesn't mean you can't keep your distance at home, and make sure more than ever that you decontaminate surfaces that are there, and that sick people don't visit them at home. Even if they've got a cold or sniffle, don't come if that's the case. I think the other issue is that people obviously who've got infection need to be quarantined and stay away from others until they're deemed not to be a risk to others. And I think the other message is that, look, in Australia, I think we're in a better situation than a lot of other countries, particularly better than the US and Europe. And so we've got advantages here. It may be because it's warmer and still, autumn rather than winter. But at the moment, we, I think, seem to be under better control of this with lack of community transmission than a lot of other countries.
One of the questions, obviously, that came up quite a lot in terms of the media of late is how infectious are children? Obviously, children don't seem to be getting very sick from this, but are they able to transmit it to other people? Do we know yet from the data what's happening with children?
Well, I don't think we know enough about the data to be absolute about this, but what we do know is there's very few children in the world under the age of 10 who have even been diagnosed with this. Now, this is quite different from influenza. When you have swine flu or any influenza, children are disproportionately infected, at 3 or 4 times the rate of adults. If adults maybe get only 4% might get influenza per year, in children, it's 10 or 15% at least. And with swine flu, it was over 20%. And it was obvious that children were sick. They know when they're sick, they're coming to hospital, coming to doctors. This is not happening with this. It's not clear why not. Are they really getting all really asymptomatic infections? Probably not. There's no doubt children can get it and can be a risk, but relatively, children are much less of a risk to others compared to a 30-year-old, which is probably the peak infection group. Not the peak group that gets complications, but the peak people who, at least in Australia, have it, maybe because they travel more often. But so children we can't ignore, but what we can be fairly confident is the risk of children from dying from this, not that it's zero, but it's very, very low. And so for the children themselves, we can be relatively assured at this stage we are not going to have a lot of really sick children and children dying, which is good news. And that's from multiple countries. We still don't know how much of a risk they are, but this is one of the issues with closing schools. If we close schools, we're going to have to do that probably for 6 months. And then you have the issue that children have to stay home and their parents will have to look after them because they can't go running around the parks and the supermarket and being with other children. Now, at the moment, that doesn't appear to be warranted in my view because there's no even evidence that in schools they've transmitted it widely and, others have got it. I do think that people over the age of 70 shouldn't be in any crowded workplace, including schools. They need to be at home and socially distance themselves. People with major risk factors, if they're teachers and over the age of 50 or 60, they probably shouldn't be at school. But we have enough other younger relief teachers that can make schools work. At some stage, we might have to close school if it really is widespread. But at the moment, that's not the case. But this is an evolving issue we'll have to look at.
Yep, fantastic. One question, if you've already had it, do we know whether you can get it again? Is it something that you can catch multiple times?
At the moment, we think not. We think once you get it and recover from that, and that might take a while, even a couple of weeks, but generally it appears that the vast majority of people, if they get it and get over it, the virus is gone and they don't have ongoing symptoms and therefore not ongoing risk. Now, exactly how long people might have viable virus, there's a bit of variability about that. But at the moment, if you get it once, it looks like most other infections, for that particular strain of the virus, you have recovered, your immune system kicks in, and it means it's very unlikely you'll get it a second time.
One of the questions coming through is, do we know what the effect of the virus is in terms of pregnant women and whether it has any impact in terms of the fetus or the actual mother?
Yeah, on the available data, I'm not sure women who are pregnant are actually at more risk than people in their same age who aren't pregnant. Obviously, if you're a 40-year-old, it's more of a risk than a 30 and than a 20-year-old. There's also some evidence that some, young newborn children have been able to get the virus. But again, if children are otherwise healthy, including newborns, there doesn't seem to be a high complication or mortality rate. It's very low, and this is very rare. So overall, unlike swine flu, when pregnant women seem to be at a slight increased risk compared to their, other people their own age, this so far isn't even like swine flu. You need to be careful, and probably more careful when you're pregnant. But this is not, and also because a lot of people who've got this infection are in their 20s and 30s, so probably the same age group they're socialising with. So I do think pregnant women need to keep their, social distancing, practice all the good hygiene, etc., avoid crowded places, etc., etc. But the other good news is they've got children at school. The children still seem to be less of a risk to them than probably their friends are, relatively at getting it. And if they do get it, there's not a lot of evidence that they're at a huge risk compared to things like rubella, for instance, or even swine flu.
Fantastic. If someone does have a client that they suspect might have COVID-19, who's come from overseas recently, or even if they're within the community and mixing with people who may have come from overseas, what sort of things should they do, and how should they handle that client? What advice should they give?
Well, I think actually if they're visiting anybody who looks sick, I think the good answer is don't visit them. Do it by teleconference. You should avoid anybody who's sick. Now, in Australia at the moment, anybody who's sick is going to have, the common cold virus or influenza or something like that, which is still what's happening in the community in Australia, in low levels because we're still in autumn. But everybody needs to avoid anybody that's sick. So the clients need to tell your staff if they are sick, because if they are, people should not visit. If you get caught in a situation where you notice they're sick, you should be more than your 2 metre distance anyway. And I would think, look, I think it's better if we continue this by telephone, and then do all the things about washing your hands and taking the extra care. So I would think if somebody's sick, extract yourself from that situation. You shouldn't be there because they should have told you, but that aside, that's what happens in reality. Extract yourself from the situation and do the follow-up by phone until they are better.
And you would be advising them to contact a GP, is that correct?
Oh, look, if anybody's sick, it depends on what the circumstances are. If they haven't had any risk factors and they're only mildly ill, they might talk to their GP, but one would think, well, you've probably got, what is going around, and okay, you need to avoid others because we can't be 100% sure, but providing you're just getting better, treat it with Panadol and just see how it goes over the next day or two. If you don't get better or you're getting worse, then ring your GP. So if somebody is very sick, yes, they need to contact their GP straight away, and particularly if they're getting increasingly short of breath. But if, they've just got a running nose, well, that is most likely a cold, and we don't want to overload GPs with, that's different if you're in one of the risk groups, like, somebody's just returned from overseas in the last 2 weeks and you're in the same household, that's different. They do need to contact their GP. But if you haven't got any risk factors and you've got something that looks mild, I would just treat it and only contact your GP if you're getting worse. But I still think your staff needs not to be there. They need to extract themselves, because that's what should happen all the time, I might say. And particularly if it can be done by phone, it then needs to be done by phone. Even if people are one of the options is they can stand outside and look through the window while they're talking to the person.
Yes, no, I've seen that. It's a new and novel way of face-to-face. You talked a bit about shortness of breath. Can you talk a bit about the pattern of how the virus develops in someone? So shortness of breath is something to watch for, is that correct?
Yeah, shortness of breath is something to watch for because it suggests your lung might be involved. I mean, mostly when we get an infection, it affects our nose and our throat. So we're producing a bit of mucus and our nose is a bit clogged up and we're sneezing and coughing. But as this virus progresses, it seems to go further down your airway. So it starts off in your throat, then gets to your, airways up here, and then goes down into your lung. Now, when your lung doesn't work properly, it's there to put oxygen into your blood. So it's interfered with because you've got an infection there, whether it's pneumonia or even, because you smoke too much or whatever. The reason you get short of breath is because your body senses there's not enough oxygen getting into your blood fast enough. So you breathe faster to try and get that oxygen in. So if somebody is breathing faster than normal and has got an infection, that is a sign to ring your doctor and tell them that, hey, I'm getting short of breath. I notice when I'm walking up, one flight of stairs, I'm quite breathless, or I'm at rest, people have noticed that my breathing rate is much faster. That is a sign that maybe your lungs are involved, and therefore you should contact your doctor. And what you might need then is to either be admitted to hospital, or at least maybe having a chest x-ray, etc., to see what is going on in your lung. Is there a problem in your lung? Because if there is, you probably then need to go to a hospital.
Fantastic. And just people who are listening, if you do have any questions, please feel free to send them in. We're certainly getting a few at the moment, but it'd be great to really understand what is concerning people at the moment. Just asking as well, across the settlement network, a lot of organisations will be thinking about best practice and what to tell their staffs. Presumably some of the key things are, if you are feeling sick, don't come in. Is there anything else that they should be informing their staff of? And should officers...
Well, I think first of all...
Is it the time to sort of for people to work from home?
Well, I think if people can work from home efficiently, yes, that's a good idea. That's often difficult, I might say, to do efficiently. So that'll be, a decision of the managers. I mean, if you're sick, don't come to work. If you're over the age of 70, I would suggest don't come to work. If you're over the age of 60 and have got a lot of underlying heart disease, lung disease, I would also suggest don't come to work. For those at work, no matter whether they've got those or not, then hand hygiene is vitally important. Even if you think you haven't done anything new, it's probably not a bad idea to wash your hands with soap and water at least once an hour. But the alcohol hand rubs, I think when you're meeting people, whether they're clients or other staff, try and keep a 2 metre distance as much as is practical. And particularly if anybody is sick, you should say you need to go home and avoid contact with them. Yeah. Okay. And I might say, I think all the government websites, the health departments, tend to have, posters in multiple languages that says what you do. It's everything from, sneezing into your elbow or coughing into your elbow, washing your hands, social distancing, etc., etc. So those need to be available in multiple languages and followed by people.
Yeah. Is it still safe to go to medical centres and hospitals, or should those be places that you try and avoid at the moment?
Well, I think if you need to go there, you need to go there. If you're worried, particularly if you've got any respiratory symptoms, you need to ring that practice before you go, because they may well want to do extra things with you, like get you to wear a mask, etc. And that is, it's probably for all people, but more so if you're, in one of the risk groups. For instance, you're somebody who's returned overseas in the last 2 weeks. So yes, there is still not evidence of transmission in the community to any extent in Australia, nor transmission in hospitals, for instance. But people who are sick go to hospitals and medical centres. So if you don't have to go, don't go. If you can try and do something over the telephone, do it. So it depends what you've got. I mean, if you've broken your leg, you're going to have to go to the hospital. If you are worried because you're short of breath, you need to ring your doctor and check out what you need to do. So it really depends on your condition. But for instance, if you need just a repeat script for something like the oral contraceptive pill, well, I'd ring the doctor and do that over the telephone, unless there's some reason you need your blood pressure checked or something. But maybe this is the time to, everybody can't go out and buy blood pressure machines, but, do as much as you can accurately without having the face-to-face consultation.
Fantastic. And is there any advice you can give about transitioning from self-isolation back into work? What things should people be thinking about?
Well, if you're infected, you don't come back to work until the local health authority has told you it's safe to do it. And that means having no symptoms for at least 3 days and usually a negative test. But that will vary a bit. But, basically, you don't come to work if you're infected until that health department has told you you can. If you're in home quarantine, well, if you go 14 days and have no symptoms, you can go back to work, because most people get sick by 5 days and 99% by day 12. So basically follow the rules that are on, the websites, both federal government or federal health department, and then from the local health departments, because that will stop 99% of all infections.
Probably last couple of questions, but one is based on the sort of modelling that you're looking at the moment, or that who's looking at the moment, what kind of percentage would we likely see infected in either Australia or globally? Do we know that yet, or is it too soon to tell?
Well, I think it's too soon to tell, actually. I mean, if you look at China, which has got, had an outbreak and then it moved to multiple prominent provinces, less than 1% of their population, even in Hubei, were diagnosed as infection, and the rest of China is probably, 0.001%. They had thousands of cases in many provinces, but they've got, tens of millions of people that live there. The trouble we don't know is how many people had mild infection that was never diagnosed. Now, that's good news because, hey, this isn't as bad as it looks. The mortality rate is a lot lower. The bad news about that, however, is that it means it spread much further, and there may be a lot of cases you haven't found. Now, in China, if that was the case, you'd think you'd still see lots of cases coming into hospital and dying, and they're testing those people. In China now, the majority of new cases are people who've travelled into China from Europe or the US, for instance. So that implies to me it isn't as widespread as you'd think. With influenza, swine flu, for instance, something like 25% of children in England probably got it. And generally influenza is 4 or 5%, maybe every season. Now, I would think it's less than that. But however, we don't know. We won't know until we have what we call antibody tests to see. The test at the moment is detecting the virus or the genetic information from the virus. So that's only while the virus is there. But once we have an antibody test, it'll tell us, yeah, we didn't find the virus in you at the time, but yes, you were infected because you've got this positive antibody test. And that tells us what proportion of different age groups actually really got the infection.
And in terms of the sorts of measures that we're seeing socially from the government at the moment, social distancing measures, the shutdowns, are we likely to see that escalate, or will it be in a holding pattern for a while?
Well, I think it depends what we see. If we're starting to see hundreds of cases that are community spread in Australia, we'll see it escalate, or thousands of cases. So I think it's going to be really what happens over the next few weeks. And then even if it calms down because we look like we've got under control and cases are going down, it'll be the same issue in winter when the risk of spread is higher. If we start seeing widespread community spread of the virus, then we will have to take bigger measures to try and stop it spread. But at the moment, the data in Australia doesn't warrant that. I mean, the vast majority of people who are infected, we can see obviously why they are, because they've just come back from an area like the US or previously Iran, China, etc., and now Europe as well, where we know there's a lot of virus. And so there's quite a large proportion of people, well, that's where the numbers are coming from. I think, I don't actually know how many people come back to Australia in the last few weeks, but I've been told there is 1 million Australians who go overseas every year. Well, that probably means there's 1 million that come back every month. 1 million a month. That probably means there's 1 million a month that come back. And probably in the last, few weeks, it's been more than, that. It's been many hundreds of thousands, I presume. Well, so, the good news is, okay, we might have thousands of cases, but if they are representative of foreign travellers, it still means it's a low percentage of those travellers. And that'll become more apparent as time goes on.
Last question. Obviously, we've been seeing the stats in Italy that have come out in terms of the current death rate, and we've been shocked to see images of hospitals being overwhelmed. What percentage of the Italian population currently has it? It's still relatively low, is that correct, or is it quite high?
Well, I think we don't know. One study I saw of the town in Italy where they did these PCR tests on the entire population, there was 4% that were positive. Now, how representative that, how good, I don't know. But even in Italy, the percentage getting it is still low. Italy, I think, is disproportionate because they're one of the older populations in Europe. They're quite different to Australia. I think, I can't remember the numbers, but if our average age is, say, 35, theirs is about, 59 or something. They have a large proportion of their population who are 60 years and older compared to us. So that's why they're seeing more cases relative to us. And it may be, you know, I don't know the differences in health systems as well. And also, I think we've put in restrictions much earlier than Italy did. I think because it's their winter, there was a lot of spread through the community before they realised there was a problem, which is not the case in Australia.
Yeah, fantastic. Thank you so much for joining us, Peter. I know
Okay.
you're far at the moment, and we really appreciate the time and for answering the questions.
Okay. Thank you. Bye.
Thank you. Thanks, Peter. And for everyone on the network, this is one in a series of webinars that we'll be doing. Stay tuned as Sam will be sending out to the community of practice what we might be looking at in the coming period. So I think we have 2 lined up to go. And thank you everyone for joining us. Stay safe.